Thank you for bearing with us despite the technical issues. To continue, I want to talk a little bit. Dr. Allami, you made a really good point, so I want to take that and build some more on it. Your answer really cleared out the picture, but let us compare the way the Moroccan government handled sending foreigners and residents stranded in Morocco back to countries of residence versus the way it handled bringing home Moroccans stranded abroad. Mrs. Rhanem, my question is to you. Spanish news agency EFE said that Morocco made available a series of repatriation flights to help foreign stranded tourists go back home through Moroccan airports. We are talking here about tens of thousands of tourists and hundreds of flights. Why wasn't that same logistical strength deployed to bring home our citizens?
Yeah. Thank you so much for this question. Actually, this question, has been asked 30,000 times during these 3 months because as a citizen, we've been questioning why they have been different operations to repatriate many foreigners that are blocked in Morocco and not handling the same issue, since there have been anyway diplomatic and security and other measures that have been taken into consideration with foreign countries to conduct these operations to bring back all those foreigners who were stuck in Morocco. Why not Moroccans who were blocked abroad? I think nobody has the answer, but I think we can think about why they should have not been done. Let's assume we have a certain scenarios to think. Maybe we cannot think on behalf of the government, but at least there must be an explanation, why they have been this operation, and we have to wait until now. As I told you in the beginning of the live, today we started having seeing 300 Moroccans who were stuck in Algeria that are going to be repatriated to Morocco and being quarantined in Saidia. But as said, the issue here is that there is a communication issue. Each time we get a little piece of the puzzle of information, and we don't have any clear spokesperson who's telling us what is the plan, what is the vision, and more specifically, the lack of transparency in communicating to us the right information. Maybe there have been many efforts that have been done by the government and also by our consulates abroad, but the problem of communication makes us think that nothing has been done. That's I think a problem. Also, I think in this issue, we have heard. I mean, I don't know if you have followed yesterday. The Minister of Health in the Parliament communicated this number, that there will be repatriation of 300 Moroccans per week. But a few hours later, they have denied this information. So this creates a lot of confusion, as today we're seeing 300 actually Moroccans that will be repatriated. So there is no clarity of, first of all, who's doing what. Because of the complexity of the issue, there are many interlocutors who are managing this situation, and there's no clarity and no vision of what is actually the plan. Because if we use our logic and say that 300 Moroccans will be repatriated per week, and if we count the number of stranded Moroccans abroad, 30,800, it will take forever to bring them back. Again, here we question about the capacity of our health system, because we've been listening to let's say some justifications that we don't have the hosting capacity, and also in terms of the measures that need to be taken to ensure there is a full a package that services, more specifically health services, that are provided to these Moroccans during quarantine. Do we really have that capacity or not? So that's again a question. So I don't think we will lean towards saying that there is no goodwill to bring back the citizens back, But I think the problem here is the how the different interlocutors are communicating about the issue. There are a lot of rumors there are a lot of unfinished information, and we don't have any clarity about that. Again, another thing that I wanted to point out here, I've been following closely this issue. More specifically, I'm talking from the perspective of a communicator. You know, when you've been seeing that there have been efforts that have been done by our consulates to support more, I think more now, according to the latest statistic, more than 6,500, which is quite less number out of 31,000 plus Moroccans. But you know, there have been an effort that had been done, but the problem was the efficiency of communication. Not many Moroccans know about the efforts that the consulates have been doing, and there is a lack of communication about the numbers of people who have been supported, what has been done exactly. Because when we follow the official communication pages, whether in social media or their website, there is no information. And later, I think they have taken a lot of time. There is a big gap. There was a silence at a certain time that people were confusing. And many started thinking that they have been abandoned and that there's no effort. On the contrary, after a certain amount of time, they started communicating that the consulates have been doing X, Y, and Z efforts to handle the situation. But this silence gap left a negative impact on people in the sense that they started not believing, they started losing hope that there had been something that could be done. And I think this issue is a problem, because the content that is communicated and the way it is communicated to the public needs normally to be reviewed, and at least there should be an explanation. Your question is a very, very good question. I don't think anyone has a justified explanation why they have been repatriation of foreigners. And also, when Moroccans are hearing that there are many countries, even with less capacity than Morocco, that have repatriated their citizens from Morocco and even from other countries, they started questioning. So I think here, the government should have given a transparent, clear justification. And even if they don't have a plan, they should tell us the reasons why it took so much time, whether it is because of the health capacity that we don't have. There must be something, but they need to communicate about it. So I think this is the biggest issue, in my opinion, is crisis communication.
Well, those are all very fair points. And speaking of communication, I mentioned at the beginning, at the introduction, the special fund that has gathered over $4 billion. Now, my question, Dr. El Allami, has any portion of these funds been dedicated to alleviate the financial struggles of the stranded citizens, say to provide airplanes to bring them home or to create locations to host them during their quarantine? Let me know if I should repeat my question.
Is the question to me?
Yes, I'll say it again. My question is this. We heard a lot about the special fund, and the special fund has gathered over $4 billion. Now, has any portion of these funds been dedicated to alleviating the financial struggles of stranded citizens, to provide them with airplanes to bring them home, or to create locations to host them during their quarantine? These are examples, but perhaps there's more. The point is, has any of the special fund money been dedicated to alleviating the financial struggles of stranded citizens?
To the best of my knowledge, I mean, I don't have a clear idea about the fund. I mean, but I know pretty well, as you all know, that the Moroccan embassies and consulates have been supporting not all the stranded Moroccans, but some of them. I think, if I'm not wrong, the head of the government mentioned like 25% of them. Of course, 25%, not all of them, right? Second point is that I don't agree with the comparisons. We should not compare. Each and every country has its own way of handling the situation, of dealing with the crisis, and of finding solutions. Third, I agree with Karima that it's not a matter of goodwill or not. It's not a matter of lack of awareness. All of us were aware of the hardship, of the difficult situation, difficult conditions our Moroccan friends, relatives, are undergoing, but it's a matter of time, and I think it's a matter of management. Well, now, if we lack the know-how, if we lack the strategies, if we lack the tools to deal with the situation, that's another problem. And I think that the situation is difficult, is very difficult, yes, but it's not the last one. This is temporary, okay? This is temporary. Our friends and relatives, they will come back home, so, sure, all right? But then it's high time to think of future strategies, to anticipate, because it's sure that other crises will happen. They will take place, all right? Natural or human or virus or whatever. So we have to be prepared. We have to be prepared. We have to prepare strategies, human resources, financial resources, and so on. So I think that it's high time to think of the future and to anticipate and to prepare the adequate tools and adequate strategies and methods to deal with such situations. Once again, if we put ourselves in their shoes, it's another story. Okay, it's another story. I believe that a quick or immediate response couldn't be possible, because there was, first of all, in addition to the lack of adequate, let's say, management tools and management services, there was also the fear of increasing infection. And also, this is the first experience. I mean, Morocco, yes, it's true, throughout history, we have been facing, other disasters, but we were not really prepared to deal with this coronavirus. We weren't prepared. And now, talking from the health perspective, we have learned how to deal with it. And we can say that we more or less master the situation. Then we can open the borders, and then we can, invite and take care of the stranded Moroccans.
Well, with what Dr. Allami said, Mrs. Rhanem, is it possible that the government's lack of action to bring Moroccan citizens home was motivated by some greater good? For example, do the stranded Moroccan tourists represent a threat to public health if they were to be brought back home?
Well, as we spoke earlier, we said, let's not question the good or bad will. There is no bad will. No country, no ever country would like to make its citizens in this situation. So as Dr. Tariq said, we're trying to put ourselves in the shoes of the government with its own capacity and the complexity of coordination between different departments and their readiness, to host and bring back those Moroccans, and also in terms of experience and expertise. I mean, this is something new. Even our Moroccan embassies abroad have not dealt with such a crisis before, and probably the staff do not have that capacity to handle those type of situation. Although we have experienced certain crises, but this is an unprecedented crisis. So dealing with it with the current capacity is something that should not normally be improved. I think it's a lessons learned that they have experienced this. And what I think also is it is time also to reflect on what should be improved as a process in the future, because now we're thinking about post-corona crisis. There will be other crises. we're going to live with Corona crisis. There will be new measures and new roles of diplomacy in the future. And also the role of diplomats and consulates will change a great deal, because today they're not only dealing with specific services, but they're dealing with wider issues, because the issues are so global and so interconnected. So this requires more capacity building for the staff to handle this, and also maybe the deployment of other expertise and staff within consulates to handle these type of crises. Again, here, when we talk about issues of coordination, I think we're leaning towards the digital transformation in the future, as we've been seeing that most of the services are going digital. So I think the way of doing business will be changed. And I think consulates now, maybe they could learn from different other countries as a benchmark to use artificial intelligence and digital tools in order to identify Moroccans, connect the Moroccans, whether Moroccans living abroad or people who might be in a critical situation through mobile applications and other types that many foreign embassies today are using to connect with the diaspora and also with their own citizens in difficult situations, so that they can better manage this situation. Because at the beginning of the crisis, I think the problem was when the Ministry of Foreign Affairs issued those phone calls so that citizens would be calling and joining the embassies at in a certain time. We heard that a lot of Moroccans have not been able to reach those phones. So there were difficulty, and because there were a lot of traffic on the phones, everyone is calling. So maybe that was not a better option. If we have digitalized systems, probably to ensure that information is reached out to the maximum, maybe using mass media and other types of communication to raise awareness, because how embassies are supposed to know that there are Moroccans in X city that are stranded if they don't reach them? Of course, there have been many initiatives by many Moroccans who have done their own personal initiative to collect information from Moroccans who are blocked and connect them to the consulate. But if the consulates in the future improve this through artificial intelligence and other systems, they will be able to systematically connect these Moroccans and reach out to them quickly in terms of crisis and handle this situation. So as now we're talking about how are we moving forward, not just Ministry of Foreign Affairs, but in terms of government, how are we going to set up everlasting sustainable crisis communication committees within the government, and also subcommittees that will be handling these type of crises in the future. So we should be proactive and not be reactive without any scenarios and any clear plans to bring these Moroccans, because I think these Moroccans today, they have the right to know when they're going to be back home. So I think this is something that took a lot of time, and I think it needs to be resolved very soon.
When the borders will be open.
Go ahead, Dr. Allami.
I said, when the borders will reopen.
Sorry, I have one thing. So in regards to that, there was a certain time that there was a lot of calls in and out in the embassies and consulates, and people, they couldn't reach out to them. So I have proofs that there was a lot of consulate closed. People, they went and there was like kind of piece of paper written on it that we are closed today and until further notice. So I can give an example, one in Toulouse in France, one in Senegal. So there was even no advance notice that we're gonna close. This is one. Two, returning back to Morocco, it is a constitutional right. So nobody can tell us when we need to go in or out, and not informing us in advance that we need that they're gonna close the borders. That was the biggest issue, because there was people leaving on the 12th March, taking flight from the airport, and nobody ever told them that we will be closing the borders tomorrow. This was the biggest issue.
Isn't that the whole point of having a health emergency, of declaring a state of health emergency, is that the state does reserve that right? And didn't the government already inform the population that they were going to do it at X day before, obviously, day X?
Some of the people that I know, they received the email at midnight. And some, they didn't even receive any email. There was no emails, like official announcements say that the borders will be closed, like let's say 2 days before. All the countries did that. Even where I am living right now, Maldives, they announced that for like 3 days before that, in order everybody can come back, or whoever in here can go leave. This is one. Two, for the like you, I think Mrs. Karima, she said that maybe they did some, let's say, some good things, and we are not informed due to lack of communication and clear informations. I would say that all what they have done to us is ignoring us, because what I felt as a stranded person is that there was no communication, nothing, because to leave a person for 3 months, this caused 4 or 5 days. One person in Ceuta, 2 people in Algeria, 1 in Spain, and I think in UK also. So those people, they matter to us. So we don't want to lose those people. So this is like a huge. We had a lot of damages happen to us, and it's really hard to recover from all these damages. It's not letting us going in. It's gonna like. It's like a cure to us. It's not. It is very hard for us to live and see people living in front of us. I'm working in Maldives. I have more than 35 nationality working with me. Difference. I have Bangladeshi, Indians, and so on and so on. Their health system is like weaker million times than us, and they took their citizens from here. And if we see, for example, Tunisia, they were the first who already recovered from the novel coronavirus pandemic, and they already rescued their people. So it's not a question of like health and they don't have enough space and all these things. I don't know what was the reason of closing. I think Morocco is the only country who shut its own borders on their citizens. It's the only country so far from what I know. Thank you.
Many countries have closed down their borders. Maybe they have had different approach, but many countries have
they close the borders. They close the borders, but not on the citizens. So they close the borders, but not for the citizens. So the citizen, if for the person, if he can afford the ticket, can go, but they cannot. Like some of them, they couldn't send the rescue flight. That was the problem for some of the countries.
Okay.
Thank you.
Thank you. No, thank you. That it's very important that we do get a live testimony from someone who is currently in the situation. Now, just to go back to really dig in some more in the topic, the stranded Moroccans have expressed their willingness to be quarantined upon their return. So my question to you, Mrs. Rhanem, is with that assumption in mind, do they really represent a threat to public health, the Moroccans stranded abroad?
Well, I think that's a pertinent question, because even if we're not even talking about Moroccans that are stranded abroad, when we are now in quarantine, and of course we've been seeing many others who are not even quarantined, we're questioning sometimes the use of certain measures that have been loosened throughout the time. I heard a lot of statements that many Moroccans who were stranded were even ready to pay their own flights, to pay their own hotels, to be quarantined in their home if there was an issue of a budget and a lot of other reasons. But there was no clarity in terms of that. I think first of all, the health capacity. We know our health capacity. We know our capacity, even in terms of human resources, and to what extent we are ready and able to handle this situation by bringing 30,000 Moroccans. The problem here is that when Moroccans are seen in other countries with even lesser capacity than Morocco in terms of health, in terms of means, etc., who have been able to repatriate their citizens within the framework of these 3 months, then here we started questioning what is the reason. Again, here we needed explanation. I cannot give you the explanation. I'm a civil society actor, I'm a citizen, I'm not government, I don't have responses. We're calling the government to give us explanation, because that's like a kind of $1 million question that everyone is asking. Why other countries have been doing this, and why not us? And when you compare the capacity, you said, okay, they have lesser capacity than us, but they have been able to do so. Second is that, do we really have a clear plan? Because this week we have been confused. We're going to repatriate 300 per week. No, this is false information. We don't have any vision, any clarity about whether there is a plan or there's not a plan. There have been a lot of rumors. We've been hearing that there will be a repatriation before Eid, and then again after opening the borders. Today we heard that Royal Air Morocco will resume on June 15. Is this an indication? The problem is that you hear little pieces from everywhere, but you're not able to connect the dot. We need to hear a government official responsible to tell us what's going on, what will happen. For the repatriation plan, what has been done for this plan, and what has been prepared for them, because the issue is not only the safety of Moroccans who are in Morocco and the safety of Moroccans who will be repatriated and be in quarantine somewhere, but also what are the health measures, physical and psychological measures that will be provided to these Moroccans, because they have been in very critical situation for 3 months. Some of them are not even in hotels. They are in very serious situations. And they will be coming back to Morocco. They will be again quarantined for 14 days. So what has been prepared for them? So they spent 3 months, very critical and serious 3 months. And it's very hard for me when I put myself, maybe I'm quarantined at home, and it's very difficult for me when I put myself in the shoes of, because that could happen to me, that could happen to you, that could happen to anyone. And exactly. I think it's really high time to have an official answer and a clear plan with date, because not only the Moroccans who are stranded abroad need to know, but we as citizens, we have the right to know when our Moroccans are going to be back. Everyone has a friend, a family member who have been blocked abroad in very difficult situation, economically, financially, and it's very difficult to imagine the impact, and also the post coming back, how their life will look like, So I think here at the beginning of this crisis, we started seeing a little bit of trust that started being built little bit by bit between the government and the citizens. But this issue, really impacted at a certain time badly this trust. And I think we need to have an answer as soon as possible, because lack of transparency, lack of information, lack of communication will impact this issue, will impact this trust, and also will impact the image of Morocco and the relationship between Morocco and its citizens.
Thank you for your elaboration, Mrs. Rhanem. Before ending the talk show, Mrs. Chafik, as the Moroccan stranded abroad, what message would you like to communicate to officials on behalf of Moroccan citizens stranded abroad?
So I have only one message to say, that we are really tired. We had enough. 3 months is more than enough for us to stay away from our fathers, mothers. There are some people who are getting like they're missing their treatment for cancer. So these people, they have been fighting with cancer for years and years, and we can't just come and just destroy all what they have done. So we need immediate response to our messages, and we are not seeking from you to come out and say anything except that the flights to come and repatriate you will be on the days, like the specific days. That's it. So we can't stay and wait for more days or months, and all what we had is already over. Money, everything. Some lost the jobs, as I said, and so this is what we want, and this is our right, and this is what we will keep on saying until we will go back home. Thank you so much.
Thank you, Mrs. Chafik. I direct the same question to Dr. Allami. Any closing remarks? And of course, after that, Mrs. Rhanem.
Well, that these people are undergoing hard, I mean, emotional, physical, financial, mental difficulties is, I mean, crystal clear. And we agree, I mean, with them. And they have the right to express their disappointment, okay? And it's hard to ask them to be rational and to, you know, and to be, to understand the situation and to forgive, to understand all is to forgive all. It's hard, but at the same time, I think that it's high time to figure out, to come up with new strategies for future situations. I have some questions. I'm not, specialist of legal matters. I have questions about the international community. I mean, the legal side. What are the rights of these people at the international level? The host countries, what's their duty? What's their duty vis-a-vis these people? And I have another question. You may ask, experts. The insurance companies, when we travel, we pay for the visa, we pay insurance. These companies, what do they do? I have a question.
Those are good points.
About the civil society. Many Moroccan NGOs abroad, I don't know whether they're active or not. Civil society abroad and civil society within Morocco. I think that, as I said before, the French say, la comparaison n'est pas raison. Right? Yes, we shouldn't compare with countries without, without enough capacity. There are countries with higher capacity. I've watched videos about made by Americans stranded in Morocco, suffering from the same situation. So it's not a matter of higher or lower capacity. As I said, it's a matter of know-how. It's a matter of management. And as I said before, it's a multidimensional, highly complex situation, which requires rigorous measures. And I hope, from the bottom of my heart, I hope that these people will come back soon to their home country, and it will be a great experience for all of us, for them, for the government, for the institutions, and Isabro, let's hope for the best. Let's hope for the best, and I believe that they will come back soon. I'm not official, I'm not a government representative, but my feeling is that they will come back soon, inshallah, and hope to see them in good health and good shape, and psychological and physical. And we feel sorry for those who suffered and those who passed away. In Morocco, other people passed away, and I think this is a good lesson for all of us, and all stakeholders and all actors should take part in thinking about future measures, rigorous, as I said, rational measures to take. Thank you very much.
Thank you, Dr. Allami. Mrs. Ghanem, any closing remarks?
Yeah, I think just before giving my final remark,
Go ahead.
Dr. Allami talked about the role of civil society. And I think, personally speaking, I've been seeing many initiatives from civil society, from Moroccans from the diaspora, who have done a lot of efforts in order to connect these Moroccans to the consulates, but also host them in their homes. But it is a sole initiative. It's their personal initiative out of solidarity, but this is not per se their sole role. The role is the government's role to find out a solution. But I think looking ahead at this great lesson learned, I think we hope that this crisis will be managed better, and of course we will be seeing other crises in the future. So I think the issue here is to work on being prepared for other crises, on better handling, crisis. Dr. Tariq talked about the know-how. I think the diplomats today, because I think even if it is not their sole responsibility in terms of health emergency, but they need to be trained, in crisis management and also in crisis communication, because those two are one of the causes that impacted more this situation badly is the lack of transparency and the clarity and the communication. Also, I think what is important here is the exercise that the government is doing now in interagency coordination, because one ministry cannot take the decision by itself, because one decision falls under different departments, and sometimes the chain of the decision making is so complex. So I think
it's an issue of bureaucracy.
Among many others, but there is bureaucracy, of course, and maybe, for example, if they're going to deploy measures and resources, each administration has its own procedures. So probably, maybe they should look at it from the legal perspective, for example, probably pass on certain legislation that allows smooth, coordination and deployment of funds between different ministries to handle this crisis, and improve the level of coordination and the level of response to handle these type of situations. Then again, as I said, the other challenges is digitalization, and it started before coronavirus. Many foreign embassies of other countries are using digital platforms in order to connect and manage these type of crisis and train their staff on that. So I think this is something that needs to be taken into consideration, and we need really to prepare for that, so that if we faced by other crises, we will be ready to handle it in the future.
Well, go ahead, Dr. Allami, go ahead.
It's as a matter of fact, it's a proposal. I don't know whether it exists or not. I know that within the Ministry of Interior, we have the crisis cells.
Yeah.
Okay, I think that in our consulates and embassies, we should have crisis monitoring centers or cells.
Exactly.
In charge of communication and management of any type of crisis. Thank you.
Thank you. Well, we will have to wait and monitor government's decision regarding the matter of stranded Moroccans in the next couple of weeks. Either way, one thing is certain: it is past time for Moroccans to come home to their families, jobs, and ordinary lives. Thank you to our guests for answering the questions. Dr. Salmane Tariq El Allami, professor at Mohammed V University and expert in media and humanities; Mrs. Karima Rhanem, expert in public policy, strategic and digital communication and diplomacy; and Mrs. Khaula Chafik, a Moroccan stranded in the Maldives and founder of Facebook support group for stranded Moroccans. A thank you to our audience for watching our show tonight with me, your host, Asmae Habchaoui, on Morocco World News.